Welcome to the iTreat MD patient engagement application. This overview will demonstrate how a busy orthopedic surgeon would use the application to very quickly and accurately document a patient visiting for evaluation of a stiff, painful shoulder. From the history and previous visit, the orthopedic surgeon has determined that the patient's diagnosis is adhesive capsulitis. First, let's start with the patient list for the day. Here, in this view, you can see that the physician has started his day and already has seen Howard, circled in red, and has a busy schedule ahead, patient circled in green. Let's pick up the process while a patient is still in the room and the examination is in progress. Of course, the physician is free to document this encounter after the patient has left the room and may also add some details before saving the final document. I will quickly step through the documentation process and call out the key components of the examination. In assessing adhesive capsulitis, the physician will record various ranges of motion and pain thresholds quickly. Review the X-ray directly and note the radiologist's report. Finally, the physician will recommend treatment and send out patient information via email or a portal. If the practice uses an electronic medical record, such as Athena Health, the encounter documentation will be uploaded in the EMR. Let's step through the process and select shoulder. We will very quickly see these are all of the best practices and conditions that this practitioner uses in assessing adhesive capsulitis along with other shoulder injuries. Next, we will choose adhesive capsulitis of the left shoulder. We can very easily see that the patient's initial visit is recorded here as well. There was no significant past medical history, there was no previous surgical history, and currently the patient is taking medications for high blood pressure, and the physician can very quickly state what they are. Lisinopril, 20 milligrams. And the patient has no allergies and happens to exercise regularly. Review of systems indicated pretty much a normal condition, and prior treatment included some physiotherapy, some pain medication. Now, proceeding to the physical exam, the patient has had pain for almost a month, and the physical exam reveals pain at the biceps, pain at the joint line, and the neurovascular condition is intact. Now, in measuring the range of motion, the physician can very quickly indicate that flexion is reasonably normal, abduction is much reduced, external rotation fairly normal, and internal rotation fairly normal. Similarly, strength on abduction is reduced, external rotation and internal rotation are within normal limits. The physician has examined the X-ray directly and found no abnormality, and also read the radiologist's report and found it to be normal as well. Now, proceeding to the plan, upon this examination, the physician is going to recommend physical therapy, a cortisone injection, and some NSAIDs for treatment. Finally, no further imaging is required, and the patient is to come back in 2-3 weeks. The ICD-10 number has been pre-selected for this condition, so merely touch that. Finally, the billing code, since this was an established patient, had a level 2 exam, and an injection was going to be undertaken before the patient left, and Depomedrol would be selected. The results of this exam are now saved. Now the physician or his office staff can proceed to include patient education information that can be sent to the patient, along with instructions for taking the medication and the explanation of what the cortisone injection was going to entail. Now, that can be saved as well. The treatment is confirmed, and since the patient did not have capsulitis on both shoulders, we can confirm. We are now taken to a summary page where we can see a summary of the visit components that were used, a preview of the email to Valerie, and a preview of the encounter note. And let's take a closer look at that. This note can be uploaded into the electronic medical record, and as you can see, it is very complete. Patient history, patient physical exam, assessment plan, and patient information was provided. The plan is saved and submitted. And back to the scheduled patients of the day.